exactly why exercise is important. What happens? Your muscles, when they get deconditioned, they use more oxygen, which leaves less oxygen for your respiratory system, okay? And primarily that is one of the big reasons for anybody with lung disease to exercise, okay? So that you get those muscles in shape. And then you also get that aerobic component. Aerobic and, some weight, strength training, they all go back to those muscles. If your muscles are in shape, they're going to use less oxygen. So essentially, if I'm walking through the grocery store and the oxygen's going to those muscles, that's getting you through the supermarket and not to your lungs. So that's why exercise is really, truly important. A lot of times what we've seen is that when people start exercising, their oxygen needs decrease. A lot of times people will come in, they're not on oxygen, we get them exercising, now they're on oxygen, they get to a point where they've been able to work up to get their muscle strength back, and aerobically they're doing well, and they come off the oxygen. So I don't say that for everybody, but that's kind of the trend that I've seen is oxygen kind of goes up and then sometimes it'll go back down. It's not just something that, you got to exercise just because we tell you to exercise. There really is a scientific reason behind it. The shortness of breath snowball effect. And I like using this with a lot of people because what happens is when you have any lung disease, okay, you get short of breath. When you're short of breath, you start doing less. And that's just a fact of life, okay? So let's say before you used to go out and you used to walk your dog every morning. That was your routine. And now all of a sudden, with most people, a lot of people, it hits them like that. All of a sudden, one day I'm fine, the next day I wake up and I'm short of breath. What in the world happened here? So you go out, you're walking your dog, and then one morning you wake up and you're like, it's a little bit hard to breathe. I don't think I'm gonna walk my dog today. What happens? The muscles aren't being used anymore. You're not getting any aerobic activity, and that just keeps snowballing. Because the less you do, the less you're going to keep doing. And then all of a sudden now your life has completely changed. Where you used to go to the grocery store, things were fine. Now you dread doing all of these things. And it doesn't get any better. That is a known fact. It will never get better unless you try to reverse that. But that snowball, it just keeps getting bigger and bigger and bigger. And you're going to do less and less. And breathing and oxygen needs go up. Again, why? Because those muscles, they need more. Because they're not in shape. Excuses aren't really excuses, and I really like this a lot because people that have any kind of breathing problems tend to beat themselves up. I'm just lazy. I just, I really, they're really, those excuses that you have with COPD, they're real excuses. I'm short of breath. I don't want to go out. Going out and being short of breath is probably one of the most anxiety-provoking things that I can think of for a lot of people. It brings tears to people's eyes, and when you are that short of breath, you don't want to do anything. I don't want to do anything. If I couldn't breathe, I don't want to go out and do anything. So it's not really an excuse. I mean, it's a fact of life for you. So it's just a matter of changing what you're doing so that, you're always going to have some shortness of breath, okay? But we'll talk about a little bit later some things that you can do for that shortness of breath. Other things really quick, everyone holds their breath exercising. Everybody. Okay? Not just someone with lung disease. Everybody holds their breath when they exercise. So, the key thing to remember is you've got to tell yourself to breathe. And especially if you have COPD. And today when we're doing some of these things, I'm going to prompt you and you'll kind of get a feel for what I do and how I can make exercise more palatable, okay? It's not so bad. I can do this. All right. The keys, again, to decreasing shortness of breath with exercise and other activities we've talked about. Once you get in shape, but in the beginning, what you're really going to be focusing on is breathing. And a lot of people don't realize that breathing and proper breathing techniques are key, especially in the beginning. They're key to helping you feel better about what you're doing so that you can continue doing it and progressing. The breathing and why it works. I imagine a lot of people here, if not everybody, is familiar with pursed-lip breathing. I personally use it when I exercise. Pursed-lip breathing works because what it does is you create this forceful breath when you're doing it. So I'm going to just demonstrate, okay, because I see a lot of people doing pursed-lip, but there's got to be one component that is with that pursed-lip breathing where it's not going to work. Okay, and that component is, I'm breathing in and, probably can't see, but my cheeks are puffing out. You have to create a pressure. If you don't create that pressure, it's not going to work. And what that pressure does, like you had talked about earlier with CPAP at night, that pressure, it opens those airways briefly. It extends them open, gets that stale air out, and helps the fresh air get in, or the good air get in. And you're going to get more oxygen. If you haven't ever tried it, you have finger pulse ox, I encourage you to do it. Okay, put the pulse ox on, start taking some good, and you will see it may dip briefly, but then it's going to start climbing. Okay, so try it. Maybe quite not as effective with some people that have some other diseases such as fibrosis, things like that. However, everybody's a little different. So just remember when you're pursed lip breathing, you've got to have the pressure. Okay, I know a lot of women that I've had, and some men too as well. Well, gee, people are going to know. Well, yeah, they're going to know. But when I'm out doing my thing, I don't really care. I mean, that's how you're going to keep your breath. Okay, the other thing pursed lip does real quick, it slows your breath down. Okay, so when you're breathing and when you, let's say you're walking through the store and you're exercising or whatever, you tend to, okay, that's not effective breathing because you're breathing in and you're breathing out and it's almost at that same rate. You're not letting enough time go by, and that's what pursed lip does. It allows that time, that exhalation time, so that you can get that air out, and it also slows your breathing down. Abdominal breathing, real quick. Abdominal breathing is something that I went to see a physical therapist about 2 years ago, and he said, you know, Michelle, are you doing abdominal breathing? And I thought, no, I'm certainly not doing abdominal breathing, and I'm a respiratory therapist. I know better. Abdominal breathing, and it takes some practice, but you can do it. A lot of times I tell people to lay on their bed, put a book on their belly, okay? And the goal is to move that book up and move that book down, okay? Abdominal breathing does a few things. It really helps. It helps your diaphragm, okay? But it moves that stomach out. And when you move the stomach out, the diaphragm can come down more. Your lungs can expand a little bit more, and bingo. We've got some more oxygen in there. We've got some really good effective breathing that, again, that will increase your oxygen saturations. Okay. Here's my simple word about pacing. I'm going to put this up on the screen really quick. Pacing, 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 pacing. I'm a fast walker. Really don't like to do things slow, but when you have any type of lung disease, pacing yourself is super important. Okay? Again, it goes back to kind of the COPD effect. If you're out of breath, then you don't really want to, you don't want to walk, you don't want to exercise. But by simply learning how to pace yourself and keep yourself, it doesn't look too green here, but keep yourself in this green zone. This green zone is where if you're doing any physical activity, you want to be here. You want to get, it's hard, but you don't want to get to the very, very hard portion. And what I tell people is, can you look at me and you say, hi, my name is Michelle Pollock. Okay, that's a simple little tool for you to use if you're out. And if you can say that, then you should feel pretty comfortable. But once you get to the very hard, it's really hard to kind of backpedal and go back up to the hard unless you stop and let yourself recover, which that's what you need to do. If you get up to the point where it's very hard, you always need to stop. You need to do some good abdominal breathing, some pursed lip breathing, and before you know it, you're ready to continue. But the goal again is to stop before you get to very hard and learn, okay, I'm walking this fast right now. Boy, I'm getting there. I'm getting to very hard pretty quick. So what do I want to do? I want to slow it down just a little bit. Okay? Slow it down. And that goes with just daily activities too. You know, we get in a rush, but just remember to try to pace yourself. It is super, super important. It's hard if you've always been a fast-paced person, but you can do it. You'll see that you can do more because you've paced yourself. So yes, I was able to do this, and now I can move on to this because I'm not, you know, huffing and puffing and not feeling too great. So, okay, let's do some exercises. Everybody ready? So face your chairs forward if you want. Okay. Leg exercise is super, super, super important. One of the things that you pretty much can work your legs every day. Legs are important if you're you're on prednisone a lot, there's varying studies, but prednisone has been shown to really cause some muscle wasting, some muscle atrophy, which is, again, what we don't want because we may already have some of that. So if you are on prednisone use a lot, you need to really be focusing on your legs. Okay, so when you're sitting down, and you can use ankle weights with these, and you can not use ankle weights. But this is a really simple exercise. You put your hands on your quad muscles. These are our quads, okay? Quadriceps. And what you're going to do is you always want a nice posture, okay? We want to have our shoulders back. We want to try to relax our shoulders as well while we're doing this, okay? All right. And if everything is open here, we never want to be looking down at what we're doing because we know what we're doing. And when you look down, it's kind of hard to breathe, okay? So we always emphasize good posture. All right. And with your hands on your legs, you're going to bring one leg up, 1, 2, and you're going to hold it for a second and down. Okay. So, and you're going to bring it up, and you're going to breathe. And down. And bring it up. And down. And see how slow this is. And when you bring that leg up, can you feel on your hand and breathe? Bring it up. And down. Do you feel that leg muscle? Okay? You want to feel that muscle. If you're not feeling it, when you're bringing your leg up, you really want to squeeze that muscle. Squeeze that leg muscle up there and feel it and down. Okay? And you can do these as many as you want. Okay? You want to do at least 10. I try to do 10 on each side. Okay? And then I'll go back. So let's continue and finish this side. We can go up. And remember, you need to be breathing this whole time. Let's do the other leg, okay? So, take a big deep breath in. Exhale, bring it up. And hold it up there. And bring it down. Breathe in. Exhale. And then bring it down. Good. And again, bring it up. And feel that leg muscle and bring it down. And up and breathe while you're doing this. Don't hold your breath. All right, done with our first exercise. I'm going to do 2 sets of 10. You could do 3 sets of 10. You could buy ankle weights. They have some really good ones at Dick's Sports, by the way.